Good day, everyone. I'm Dr. Lloyd Douglas, a public health physician with IFNA. And today I'd like to talk to you a little bit about the COVID-19 vaccine. So the IFNA member communities are Whitesand, Laxul, Muskrat Dam, KI, and Pikanjikam. And it's been a pleasure working with these First Nations during this very, very difficult time. So it was a historical moment for the Sioux Lookout Minayawan Health Center when they administered the first Health Canada approved COVID-19 Moderna vaccine at the William A. George Extended Care Facility. And the good thing about this is that the first resident to receive the vaccine was a First Nations elder. Her name is Eunice Fiddler. She's 85 years old, and she was joined by her daughter, Margaret Beardy. And indeed, this was a very proud moment, not only for the healthcare center in Sioux Lookout, but for the entire region. Now, COVID-19 is real. You know, we have had over 700,000 cases in Canada. In Ontario, over 240,000 cases. Among First Nations across Canada, over 12,000 cases. And First Nations here in Ontario, over 382 cases. And, you know, I'm saddened by the fact that we have lost about 113 First Nations to this terrible disease. Now, what's the goal of this vaccine program? It's very simple. The goal of this vaccine program is to prevent illness from COVID-19, prevent death. And while we are still working and looking at the evidence, we hope that the vaccine can help us to end this pandemic. So about the vaccine itself, the vaccine that will be used in our region is called the Moderna vaccine. It's an mRNA vaccine. It's 94.5% effective, and it's approved for individuals 18 years and older. Recently, it was approved for pregnant and breastfeeding women, and trials for children are currently underway. And individuals are given 2 doses 28 to 35 days apart. Now, you know, you may be hearing lots in social media, on the internet about the vaccines. Presently, there's no proof at all that the vaccine will alter your DNA. You will not get COVID-19, the disease, if you take the vaccine. And also individuals with underlying health issues, with immune suppressed systems, they too can get the vaccine, of course, after they have had a conversation with their healthcare provider, their physician or the nurse practitioner. Now, there are some side effects with the vaccine, but they are usually minimal and manageable. And I just checked the data today from Health Canada, and up until January 9th, we have had in Canada about 24 cases of adverse events following immunization with the COVID-19 vaccine, of which only 10 were serious, and we have had no deaths. So the common side effects, you know, include pain at the injection site, body chills, feeling tired and feverish, and of course, these can be managed. So one big question is, why did the vaccine come out so fast? And at the time of this pandemic, the entire world stopped and came together. So all the scientists, all the researchers, all the physicians, everyone stopped and came together. Governments came together. The usual bureaucracy and the red tape and barriers with regards to funding, all of that was removed. And everyone worked very, very hard to get a solution, to get a vaccine. And that's why, you know, the vaccine was rolled out in 9 months instead of a few years. I must say that with regards to the various trials, all the various phases were followed, and no steps were skipped. And not because it took such a quick time to get out means that it's less safe. So less time doesn't equal less safe. In the trials, again, they followed all the requirements were followed. Now, I'd like to talk to you just a little bit about herd immunity. And you may have heard this term before. And I'm just going to use my pointer here and talk about, three different kind of situations. So the first is the individuals in red, they're the individuals who would have kind of COVID-19, the disease. And then the others who are in orange, they're the ones who can get the disease. They're susceptible. And you can see that in a population wherein there is no immunity, meaning that individuals, they're not protected against this virus, the virus can spread. And you have lots of people who are red. Now, in a community wherein there is some level of uptake of the immunization or the vaccination, and these individuals are in blue, they're immunized, you don't see as much red. Some protection is provided, and the individual who takes the vaccine, they are indeed protected from getting the virus. And if they do get the virus, usually it's very mild. Remember, I said that the vaccine is 95% effective. And from the studies, it shows that the individual can be protected almost 100% from dying from this disease. Now, the situation that we're aiming for in the community is that we'd like to have lots of individuals immunized. So lots of people who are blue. So even if someone comes into the community with the disease, because so many people are protected, even if you have a few individuals who are susceptible, the disease will not be transmitted to these individuals. So this is what we mean by herd immunity. When we have a large proportion of the population immunized, then almost everyone in the community is protected. Now, we know that you have many questions and concerns about the vaccine. And at IFNA, we can support your community by a specific tool. We can give your community a survey, and that will be coming your way. And we'd like to understand, your confidence in the vaccine. And we would encourage everyone to partake in this survey so that we can understand how best to help you. Again, I really want to thank you for taking the opportunity just to listen to this brief video presentation about the vaccine. Your pandemic team at IFNA, we're working hard with you to help roll out this vaccine program, and also with our partners. Again, be safe. Please remember to follow all the public health measures, which include wearing a mask when you're out and about, social distancing, and washing your hands. And we all need to understand that together we can bring an end to this pandemic. And my good friend, Dr. John Guilfoyle, would say, don't be scared, be prepared. So looking forward to hearing from you, looking forward to gathering and getting that information from those surveys. And if you would like to speak to any one of us, feel free to contact us at IFNA Health. Thank you and have a wonderful day.